I'm Blair Erb, Chairman of the Pinnacle Network Work Group of the American College of Cardiology. The Pinnacle Network provides a series of tools, services, and in fact, an interactive community to support our members during this period of practice transformation. Today we'll be discussing one of the newest tools available to those participants of the Pinnacle Network. Joining me is Dr. Norine Walsh, who is the head of the ACC's new Patient-Centered Care Committee. Thanks for being with us today.
Happy to be here, Blair.
Minna, tell me, every time I go in the office, I think I'm practicing patient-centered care. What are the forces driving this, and what is patient-centered care?
So I think we all kind of got our backs up at first when we heard the term patient-centered care, because we do believe that we practice patient-centered care, but in fact true patient-centered care starts with the patient and is very focused on that patient's decision-making, understanding of the care, and what we're really interested in doing in the college, and this started with Fred Beauvais' Year of the Patient, is to bring a focus of our practice back to that patient. And what the Patient-Centered Care Committee is all about is helping you in your practice to do that.
Tell us about the tools that are available through the committee and what the committee's accomplished thus far.
Well, the committee started out as a task force and became so big that it became a standing committee in 2009. And we've done several things. Some of them involve a white paper describing patient-centeredness in the cardiovascular practice. But with regard to people in practice and helping our members, we're very focused on tools coming forward that will, we like to say, make that office visit a little bit easier for you to have and to extend that office visit outside the office. So the tools will include things like literature for patients, videos, efforts at shared decision making, so that when you and your patient are in the office, you'll be able to use these tools to help make these decisions and help your patient better understand his or her disease.
You know, these sound like things that would involve our whole practice team. Will other members of a practice team have access to these kinds of tools?
These tools will all be available to our members, both on cardiosmart.org and also in actual hard copy eventually. And so we think very much the care team, especially in diseases, for example, like congestive heart failure, are going to find these tools really invaluable, because patient-centeredness really does involve the entire healthcare team, not just the physician.
Minna, thanks for joining me today. I can imagine our audience will be interested in learning more about patient-centered care and the Patient-Centered Care Committee's tools. How should they access that information, and whom should they contact?
Oh, well, actually the tie-in to Pinnacle is that the tools, when available, are going to be available on the Pinnacle Network.
Thanks very much for being with us today.
Thanks for having me.